to make her opening statement and request that the Minister of Health invites our Deputy Speaker to make his statement, who will then invite our chief guest to officially open our summit. Ladies and gentlemen, please welcome the Permanent Secretary in the Ministry of Health. Big round of applause, ladies and gentlemen.
Right Honorable Speaker, the Deputy Speaker of Kenya Parliament, our Deputy Speaker, the Honorable Minister of Health, Honorable Minister of Science and Technology, our distinguished delegates from respective countries will be mentioning your names as we settle down. In the interest of time, really my role is not to give the speech, is to welcome you today for this inaugural meeting where we come together to review the progress, but also to chart the way forward for our country. As you heard, the theme of this summit is that we want to reclaim our sovereignty through innovation. And that's the only thing that will take us far. We shall be discussing as we go along, because I know that our chief guest has a very tight program today. Allow me really today to say, Swahili, now the word has disappeared. I'd crammed my word, but now it has disappeared. But I want to welcome you in a special way, all our guests today. Thank you for honoring our invitation. It means a lot to us because we know that if we want to go very far, we have to go together. And in this journey, we do believe that we are counting on all member states. Today, we want really to discuss how we can collaborate to make science a reality in our country and innovation so that we are able to lift each other. And we stand together, especially in the current circumstances. And the discussion is so right at this time, it is timely, that we look inside, we look at our internal capacity, internal strength, internal skills, and we harness those skills to give us the best innovations. And we do believe, and we have no doubt, that's in our minds, to it, we shall get there. So allow me today, really, I'm not going to make any speech, although they had made my speech. I want to welcome my guest, my Honorable Minister, to come and make her remarks. After that, she will invite our Deputy Speaker. Thank you very much.
Our guest of honor, the Right Honorable Speaker of the Senate of the Republic of Kenya, the Right Honorable Deputy Speaker of the Parliament of Uganda, my sister, the Honorable Member of Parliament from the Senate of Kenya, Your Excellencies, Honorable Ministers from Somalia, South Sudan, Your Excellencies, representatives from WHO, Africa CDC, our development partners, distinguished guests, and colleagues from Uganda. It is a great honor to welcome you to Kampala, to the inaugural Africa Health Summit, a gathering that carries the hopes of a continent ready to reclaim its health future. Allow me to appreciate all of you in a special way for honoring our invitation and coming today. Africa stands at a turning point. We make up 17% of the world's population, and yet we carry 25% of the global disease burden. 94% of the world's malaria cases and 2/3 of HIV infections still occur on this continent. Non-communicable diseases now cause 37% of deaths in sub-Saharan Africa. And by 2030, they will surpass infectious diseases as our leading killer. Excellencies, these are just not statistics. They represent lives that have been cut short, potentials unfulfilled, and families left behind. And yet, even in this landscape of challenge, there is extraordinary progress. Many of our countries have shown that the world may leave us behind, but equity in health in Africa is possible. We have seen examples from Rwanda, from Kenya, through its digital platform of M-TIBA, giving ordinary people control over their health care. South Africa is producing antiretrovirals and vaccines locally. Here in Uganda, we are manufacturing life-saving medicines, antiretrovirals, antimalarials through Quality Chemical Industries Limited. We are scaling up HIV testing and pioneering diagnostics through Microhim Scientifics, manufacturing various other pharmaceutical products. Our chief guest, you and your dear colleague were taken through some of the science from research and development by the Honorable Minister of Science and Technology this morning. This shows you that Africa is able. Africa is not waiting for rescue. We are writing our own script of resilience, innovation, and solidarity. But if we are to speak frankly, our progress still remains fragile. Africa imports 95% of its medicines and diagnostics and produces only 3% of the global pharmaceutical output. Our financing remains constrained, with most countries spending less than 5% of their GDP on health, far below the 15% Abuja target. Meanwhile, external assistance for health has declined by 70% since 2021, even as our debt servicing reaches sky limits, over US $81 billion by last year. This imbalance is unsustainable. Health is an investment. It is an investment in productivity, peace, and prosperity. As the African Development Bank reminds us, every $1 invested in health yields $4 in economic returns. The time has come to redefine health as a pillar of economic growth and not as a social afterthought. We must build sovereignty in production, in research, and in policy. Never again should Africa stand back and watch, or stand at the queue for the tools that save African lives like we did during the COVID-19 pandemic. The Pharmaceutical Manufacturing Plan for Africa, the Africa Medicines Agency, the African CDC's new public health order, and now the Africa Science Research Fund give us the instruments to act. Let us invest in our scientists, our manufacturers, our innovators, many of whom are women and youth at the front lines of change. There is a Ugandan proverb that says a single bracelet does not jingle. No country can achieve health sovereignty alone. We need one another to share technologies, harmonize regulations, and speak with one voice. I recently met a midwife from rural Uganda who, despite scarce equipment, had not lost a single mother in 6 months. When I asked her how she managed, she smiled sweetly and said, "We may not have much, Honorable Minister, but we have each other." That spirit of ingenuity, compassion, and collective strength is Africa's greatest resource. This summit calls upon all of us to turn that spirit into policy and investment. Let us commit to increasing domestic health financing. And I'm speaking this directly to the speakers. Scaling up local manufacturing to meet 20% of our essential medicine needs by 2035. Training 1 million additional health workers by 2030. And institutionalizing the Africa Health Summit, if you deem it fit, as an annual platform for accountability and innovation. As we honor the Heroes in Health Awards later today, may we celebrate not only excellence, but also endurance. The nurse who walks 5 kilometers daily to deliver vaccines, the laboratory technician who keeps testing even though there are blackouts, the community leader who turned despair heals itself. I thank you for listening to me. It is now my honor and pleasure to invite the Right Honorable Deputy Speaker of the Parliament of Uganda to come and address us. Come, Right Honorable.
The Right Honorable Amason Kingi, Speaker of the Senate of the Republic of Kenya, the Honorable Ministers present, my colleagues, members of Parliament, and specifically my sister, Senator Tabitha Mutinda, member of Kenya Senate, the Permanent Secretary, Minister of Health, Your Excellencies, Ambassadors, invited guests, keynote speaker, ladies and gentlemen. Mine is very small. To number one, appreciate our chief guest, the Honorable Amason Kingi, for coming to grace this occasion. He's our brother, he's our friend, and I'm sure we are going to gain so much from his statement because he knows Africa on the fingertips. He was a minister for East African Community Affairs of the Republic of Kenya at a time when the Right Honorable Eria Kategaya was also a minister. So you can see he interacted with historicals, and these are people who were driven by Pan-Africanism. So I hope we get much, much more from him. To the organizers, led by the Minister of Health I want to thank you. Because one of the challenges we are facing as a continent is tackling critical issues in a fragmented manner. We are playing safe within our very, very small and narrow zones, which is very, very unfortunate. And as you can see, when tough situations come, other people in the world, now they go into their blocks and see how to tackle critical issues. A very good example. During COVID, you saw what it took for Africa to receive vaccines. And they started even sending us those which were about to expire. I'm sure, Honorable Minister, you even had a lot of expired vaccines here. You know, because those which were about to expire, send it to Africa, send it to Africa. You know, how do we tackle such issues to ensure it doesn't happen again? You have seen just one war in Europe has made the whole of Europe redesign their budgets, reprioritize. You know, it's no longer about the health sector in Africa, people who are facing challenges, but first secure their borders. How do we secure ours? You look, most governments, you know, I don't know, the multipolar world is facing a lot of challenges. Us who are focusing so much on foreign policy, many countries are now inward looking. So we as a continent, what are we doing about it? I chair 79 parliaments of the Africa, Caribbean, Pacific. But when we are in and you look at our counterparts from the EU, you see our priorities are totally different. So how do we take opportunity of the intra-African trade, which is current at around 220 billion US dollars, to ensure we expand it? Because 14% of that, around 42 billion, is with South Africa alone. So me, beyond your issues of research and all that, from a perspective of African countries supporting each other, why should an African country be importing ARVs when we have a Ugandan company that can produce all ARVs to support Africa? Mr. Katongora and the team here during COVID saved South Africa. They were stuck, so they ran here. Why should we continue importing diagnostic kits when we have a young man in Dr. Cedric here, you know? And we have ministers of health from Africa, but we still want to get kits from abroad. Because Africa, it is estimated we spend around $14 billion importing medicine kits from abroad. I was reading one report of Afrexim Bank. Now, if that money could remain in Africa, then the banks, the governments give off-takes, you technical people decide to say that let's take advantage of African manufacturing companies. It will attract more and more investors. Even the big farmers will start manufacturing from Africa. You find a company has around 10 plants in the world, but no plant is in Africa, but their biggest market is Africa. So we have to be deliberate, Honorable Amason Kingi, as Parliament. We have to see a way of supporting local content strongly, strongly. These companies, if Mr. Katongore had not been deliberately supported by President Yoweri Museveni, the other day we were celebrating 15 years. If he had not been deliberately supported by President Museveni, who even reached an extent of lending him money, buying him tickets to go here and study, when everyone was doubting. Now the other day we launched a new factory of $52 million. He's going into tuberculosis and all that. This young man, yesterday was telling you his story. Mr. Mwangi, a Kenyan, came up and stood up and said, I'm giving you $56 million. You know, I'm proud to be an East African. Find an East African bank could take a risk on him. When our own banks are asking questions that are so difficult, Mwangi looks at the business potential and he says, I'm giving you money. What's next? We need Dr. Diana and the team to ensure that we no longer import kits so that the man can get money to pay back. That's what we need. Mr. Magora Day Farmer, the president has deliberately moved. We have supported him. So in Uganda, we are far ahead from an executive perspective in supporting these scientists. Far, far ahead. I would urge African presidents to take the example of President Museveni and maybe engage him on this, on how he's doing it. He's very deliberate that we must support local manufacturing. We cannot continue to depend on Europeans, on Americans, to design and manufacture products to come and save Africans. I think I was told quinine was manufactured in China, came from China. At the time they had malaria. Now China no longer has malaria. So why should they invest in more research for malaria products? So we have to be deliberate on this. And I pray that the deliberations and conclusions you come up with from here are implemented. Coming here to give speeches, making strong statements won't be enough if we don't implement. Cost them, engage with God parliaments, the ministers will bring them to parliaments, and we see how we support this very, very important aspect. I'm a very happy African today. Very, very, very happy African today to see that critical players from Africa are here, not only to look at solutions, but you need to come up with a clear resolution that you are going to support African manufacturers. African manufacturers for pharmaceutical products. We must come from here with a resolution deliberate that they are going to be supported and introduced by the African government. Right, Honorable Emerson, we can't wait anymore. I kindly request you, sir, to come and address us.
Let us be seated, please. Thank you. Before I make my remarks, allow me to introduce the delegation that accompanied me to Kampala, Uganda. I am accompanied by Honorable Senator Tabitha Mutinda. Senator Mutinda is a member of the Standing Committee of the Senate in charge of health. I'm also accompanied by my Chief of Staff, Mr. Ben Fraha. Now, another thing I want to say is if you speak last, if you're the last speaker, you risk being repetitive. So should I, at any point, touch on an issue that has already been touched on, don't consider that repetitive. Consider that I'm reinforcing a very important matter. My dear brother, the Deputy Speaker of the National Assembly of Uganda, our dear host and Minister in charge of Health in the Republic of Uganda, and your colleagues present, dear participants, honorable delegates, ladies and gentlemen, good morning. It is a profound honor and a personal joy to stand before you here in Kampala, a city that has long stood as a pillar of culture and resilience in our region. I bring warm greetings and deep solidarity from my brothers and sisters in Kenya. Allow me to express a heartfelt appreciation to the government of Uganda and the people of Uganda for the compassion extended to Kenya during our recent moment of national mourning following the demise of the late Honorable Raila Amolo Odinga. The memorial service held here in Kampala reminded us that Kenya and Uganda do not merely share borders. We are heritage, kinship, and we share the same destiny. Ladies and gentlemen, we meet at a defining moment for the African continent. Africa continues to bear a disproportionate share of the global disease burden, like it has already been alluded to by our host minister. While too many holds still face catastrophic health expenditures that push families into poverty, access to essential health services remains uneven and often insufficient. These are not abstract data points. They represent real lives. Families delayed from care, communities underserved, and health systems stretched beyond capacity. The COVID-19 pandemic further exposed global inequalities, where supply constraints left Africa wanting, even as others secured surplus. The moment reminded us that health insecurity is not just a development issue, it is a sovereign issue. It also reaffirmed what the African Health Strategy 2016-2030 underscores, that health is a human right, and that the resilient systems must be built through intersectoral collaboration, linking education, innovation, environment, and social protection in one ecosystem of care and accountability. Yet Africa is not beginning from zero. Across the continent, bold innovations are already reshaping the health outcomes. In Kenya, for example, our pharmaceutical sector supplies approximately 1/3 of our domestic medicines demand, and we are intentionally advancing toward 60% local production by 2030. Additionally, over 100,000 community health promoters now deliver primary health care at household level, significantly strengthening universal health coverage. In Rwanda, the use of medical drone delivery has markedly reduced response times for emergency blood supply in remote areas, saving countless lives. In South Africa, the expansion of the vaccine manufacturing capacity marks a critical step towards reducing Africa's dependence on external vaccine supply chains. Here in Uganda, globally recognized models of HIV self-testing and community-based treatment access continue to bring dignity, accessibility, and innovation into public health systems. These advancements affirm one truth: when Africa leadership, investment, and innovation align, transformation follows. Across the continent, we are witnessing the spirit of Agenda 2063, the Africa we want. An Africa capable of defining its own priorities, financing its own health, and protecting its own people. Allow me at this point to share briefly Kenya's own journey towards universal health coverage, a story of reform, courage, and conviction. In 2023, Kenya enacted the Social Health Insurance Act, replacing the decade-long old National Hospital Insurance Fund with a new Social Health Authority SHA, an imagined institution designed to deliver true universal health protection for all Kenyans. Under this new structure, 3 national funds have been established: the Primary Health Care Fund for community-level services, the Social Health Insurance Fund for comprehensive coverage, and the Emergency Chronic Illness and Critical Illness Fund to cushion families from catastrophic medical costs. Together, they ensure that no household slips into poverty because of illness. Every Kenyan household today is now being registered under this new system. and the government directly subsidizes contributions for poor and vulnerable households. At the same time, over 100,000 community health promoters already deployed nationwide are linking families to care and ensuring that financing and service delivery meet at the doorstep. This model is more than a national reform. It is a practical demonstration of how African nations can build resilient health systems through local innovation, shared accountability, and inclusive financing. It shows that universal health coverage in Africa is achievable, not in theory, but in practice. This approach echoes the Africa Health Strategy call to expand social protection, address the social determinants of health, and invest in equity, ensuring that development and health progress move hand in hand. This is the vision embedded in Agenda 2063, an African capable of meeting the health needs of her people with dignity, confidence, and autonomy. It is also the vision of the African Health Strategy 2016-2030, a continent free from heavy burden of disease, guided by leadership, innovation, and people-centered governance. To achieve this vision, we must not only diagnose the challenges, but also prescribe the solutions, and most importantly, implement them at scale. First, we must mobilize sustainable domestic financing for health, including capital markets, sovereign funds, and structured public-private partnerships. Secondly, we must deepen investment in African research about technology and innovation, enabling African scientists to solve African challenges on African soil. Third, we must harmonize regulatory frameworks to allow medicines, vaccines, diagnostics, and health technologies developed in one African state to be distributed efficiently across the continent. The Africa Strategy calls this leadership and good governance in health, a commitment to evidence-based policies, regional collaboration, and accountable stewardship. Fourth, we must empower and equip our youth, not merely as workers in the health system, but as owners and architects of Africa's emerging health economy. Agenda 2063 reminds us that Africa transformation will be people-driven by its youth and women, and that every investment in human capital is an investment in the continent's sovereignty. A nation cannot innovate if its people are unwell. A strong economy cannot stand on a weak health foundation. Every time Africa imports medicine that could be manufactured here, we export jobs, capital, and strategic security. Let us therefore embrace the call in Agenda 2063 for inclusive, sustainable growth, one that creates shared prosperity and ensures that health is not a privilege of the few, but a guarantee for all Africans. Imagine an Africa where scientists drive global vaccine development, our pharmaceutical industries supply regional markets, and our youth find purpose and prosperity in building solutions at home rather than seeking opportunities abroad. This is not a distant dream. It is the policy choice that we can make today as we sit here. Let us commit today to do the following: operationalize continental framework on the health sovereignty to streamline regulation and guarantee equitable access to medical products. Launch and capitalize an African Science Research Fund to support homegrown innovation, and also ensure that by 2030, at least 1/3 of Africa's medical supplies are manufactured on African soil. And in doing so, let us align with the African Health Strategy Goal to allocate at least 1% GDP to health research and innovation, fostering an African-driven response to public health challenges. In conclusion, let the message from Kampala be clear that Africa is not waiting to be helped. Africa is ready to lead. As the proverb reminds us, when the roots are deep, there's no reason to fear the wind. Today, we deepen our roots as Africans in unity, innovation, and sovereignty. May our deliberations here mark a turning point toward the Africa envisioned in both 2030 and the Agenda 2063, the Africa we want. An Africa that is healthy, united, and self-reliant. With these remarks, it is now my singular honor to declare the Africa Health Summit 2025 officially open. May God bless all of you. May God bless the Republic of Uganda, and may God bless our beloved continent of Africa. I thank you.
Ladies and gentlemen, a big round of applause for our chief guest. And I'll invite our chief guest to stay and invite all the ministers to join you for the group photo and invite the protocol teams to handle that. The Honorable Minister of Science would have said a vote of thanks, but our chief guest and the Deputy Speaker have another engagement that they must run to. And we request that when he returns, we'll allow for the Minister of Science to also address us. So the others will also join them. The Honorable Ministers, Your Excellencies, the Ambassadors, please do join them. And then I'll invite for the second category our scientists who will join them right at the back. And also invite from the private sector Dr. Cedric and Emmanuel Katongole. Emmanuel Katongole representing, of course, QSIL, but also the Presidential CEO Forum. We'll ask the others to join them at the back because we're using the entire tier of the stairs to represent all the key partners and stakeholders. We have the WHO regional representative. We have the Africa CDC team. We have our scientists from Botswana, the DRC, and Ghana. And we have, of course, the entire delegation from the Republic of Somalia, Ethiopia, Rwanda, Kenya, and of course Uganda, and the entire delegation represented by our Honorable Minister. And so we'll allow for photos, a few more pictures. Our chief guest. Thank you very much. We'll allow for our other guests to take their seats. Your Excellency, the Ambassadors, you may take your seats. The Honorable Ministers, we'll only allow for our Chief Guest and the Speaker. The rest of us will remain seated. As I invite Praise, Praise will be giving us a piece of entertainment before we dive into our very first agenda item, our very first conversation. And I will introduce that at an opportune time. I need to mention that the Honorable Ministers and our Ambassadors will be joining us again because they're just seeing off our Chief Guest.
Otaferwa aha tayari West.
So aha twahika turi akashozi ka Buharwe aho twinisi cyo bwira kabiri ubwahandikirwa ngo bukabahe biri kumuna mushanzu byo kwakana 1520 yamazire kuzara so nko kumwahura 1520 ubwira kabiri ubwo bubaho Uganda nke hangara karataka bwine sharo zayo kubanga Uganda kize yafune sharo zayo umwaka gwa 1898 kwize bw'abangereza so ko nko ubwire ebicweka by'inyinka Buganda nkore hiya Karagwe Rwanda Mpororo ebichweka byone byo bikabitura mu controlling w'abanyoro. They are all under Bunyoro occupation. Then ikiza cyobwire za yetongereza independent bwa nyuma ya Bunyoro kitara kingdom yamara kwa man. Abwenshonga nkisha tenkuru. Icyo kubanza no kugira ngo territory ningasho mwanya kabaho muhango barema controllinga n'icya kabiri bwo kwiyafire ababwe myaka ababantamani gabo hamwe na okutahirwa baruwo.
Late chart from 9 to midnight.
Okay, a very good evening, dear listeners. You're listening to 104.5 Reggae FM. My name is Pretty Zero, crafted from World Class. Your sassy and classy presenter, welcome your daughter. You can also welcome the people aboard. You can send your night greetings. You can request for a journey that you would like to listen to. And of course, we shall be together till we get ourselves into a correct number of the yesterday. That's going to be absolutely nice. The singles, the people that have broken out, the postpones sitting south, but it happens. Always here for you. We love it to Thursday, 9 p.m. till midnight. And of course, with crews who can jump, dedicated, entertaining, till we are out of here.
This is 104.5
Panyachigez FM. We are your #1 favorite station.
It's time to break free with AZAM TV. Grab yourself a full kit at 80,000 shillings or an AZAM decoder at 40,000 shillings. Experience the thrill of every goal in La Liga, Italian Serie A, German Bundesliga, and the excitement of live sports action from the Saudi Pro League and Carabao Cup on AZAM Plus and Play Package in HD. Your favorite China Uganda movies on Chamuka TV on AZAM Pure for just 13,000 shillings monthly. Unlock a world of sports and entertainment with AZAM TV, the most affordable pay TV around. Visit any of our agents or call 0312 308 900 for more details.
AZAM TV, entertainment for everybody.
Wait, emmere ogirese naye nga siraba kuwukawo akawe kali wano.
Tewerabira leta bubiri.
Sumulula buli alina kacupa kyokunywa kikwongera amaanyi kinywa kufunamu enjawulo kiri ku mutindo w'amanywamu eyo kalimu ebirungo bakalunga enjangawuzi bagiteekamu eri omwo ombisi gw'enjuki nagwo gusanga omwo kagaba waaka kanyweko n'owulira waaka kombucha drink kyekyokunywa ekisinga byonna era nga kikolebwa kampani y'Ekyama Enterprises Limited. Kati gwakyetaaze tufunire ku namba z'essimu zino wammanga 0701 734 oba 0783 10 38 waaka kombucha drink gw'oba onywa yekka.
Ekipya kiguse ku katale kyogera vitamin E pink jelly yaguse katale ne back to school packages wangula ne kyogera vitamin E pink jelly wamu ne kyogera cocoa butter jelly nan perfume jelly ne aloe vera jelly products zisangibwa mu maduuka gonna mu ggwanga. Gula weesigire wangula ebintu okuli t-shirts, boda, TVs, smartphones, school bags, ebitabo, school fees watamwemu, eggaali n'ebirala bingi nnyo. Gwegula bizigo okuli kyogera vitamin E pink, cocoa butter, nan perfume ne aloe vera jelly. Akalulu kali mu kizigo munda. Weesige bw'otuuka wakatikati akalulu kajeemu okumanya ebisingawo kuba noti 7 noti 214 563 oba weereza WhatsApp ku noti 7 noti 214 563. Fee haba kyogero tugamba clean your skin ne kyogero products.
Ladies and gentlemen, please give him a warm welcome as he makes his keynote address.
the Honorable Dr. Jane Acheng, Uganda's Minister of Health, members of the Parliament present, Honorable Ministers of Health and heads of delegations of other African countries present, the East Africa Regional Director for Africa, CDC, valued development partners, private sector and civil society representatives, distinguished colleagues, members of the media, ladies and gentlemen, good morning. What a profound honor it is to join you here in Kampala, a city whose strength and resilience reflect the very essence of Africa. On behalf of Dr. Mohamed Yakub Janabi, WHO's Regional Director for Africa, I extend warm greetings and appreciation to the government of Uganda and our partners for hosting this historic inaugural Africa Health Summit. By bringing together ministers of health, African Union institutions, regional economic communities, researchers, and civil society leaders, Uganda has given Africa a home for dialogue, evidence, and action. This summit comes at a defining time when the world is looking to Africa not as a recipient of solutions, but as a source of them. Its theme captures what our continent needs most: stronger systems, empowered communities, and solutions that endure. To reclaim Africa's health future, we must move from dependency to sovereignty through innovation, solidarity, and shared responsibility. Africa is the world's youngest region. Over 60% of our people are under 25, and more than 400 million are aged between 15 and 35. They demand systems that work, leaders who listen, and institutions they can trust. Their expectations should inspire us and hold us accountable. We know the stakes. Millions of households still face catastrophic out-of-pocket costs when they seek care. Financing remains inadequate. Most countries spend less than 5% of GDP on health. Climate change and conflict continue to test our resilience, but we also see extraordinary solidarity, neighbors synchronizing vaccination campaigns across borders, frontline workers risking their lives to save others, and communities protecting one another. This summit is Africa's answer, a space to turn solidarity into strategy and dialogue into decisions that shape continental policy. Let us always remember, our systems are ultimately about people. Let me tell you about Aisha Nangobi, a 29-year-old midwife and mother of two from this very country, Uganda. When Ebola struck earlier this year, Aisha lost her husband, the first confirmed case within days. She fell ill herself, recovered, and with psychosocial support from the Ministry of Health and WHO, found the courage to return to her clinic. Each day, she brings new life into the world, even as she carries the memory of her loss. Her story shows that resilience is not an institutional word. It is a human one. Behind every plan we design stand people like Aisha, whose courage turns policy into purpose and whose strength gives meaning to our systems. This is why, at the WHO Regional Office for Africa, our partnership with member states is guided by 4 pillars: universal health coverage, resilience, modernization, and ownership. Each pillar represents a promise to strengthen systems, empower communities, and advance sustainable solutions towards the Africa we want. The first pillar, universal health coverage, is the bedrock of resilient systems. To achieve that goal, we must both improve access to quality health services and address the significant financial hardship suffered by people seeking health care. Despite our collective efforts, the African region remains off track to achieve UHC by 2030. The WHO Afro Service Coverage Index currently stands at 46 out of 100, well below the global average of 68. An estimated half of all Africans still lack essential health services, and millions are pushed into poverty each year by out-of-pocket spending. Most countries allocate less than 5% of GDP to health, with the Abuja 15% target remaining largely unmet across the region. At the same time, development assistance for health has fallen significantly below 2021 and 2025, even as debt servicing costs climb across the continent. These realities underline why domestic investment in primary health care is the fastest and most equitable path to accelerate progress towards UHC, building resilient systems that protect every community in every corner of our continent. However, across our region, we see progress. Uganda's pharmacy-led primary care model brings services closer to communities, and Kenya's digital health financing platforms extend protection to millions. Rwanda's community-based insurance now reaches nearly every household. These examples prove that innovation and equity can walk hand in hand. And they translate into lives like that of Alimata in Burkina Faso. When she first learned she was HIV positive, she thought her life was over. But thanks to continuous antiretroviral treatment and counseling, she is thriving, running her business and mentoring others. Her story is the definition of empowerment, how care saves lives and hope sustains them. In our region, more than 20 million people are receiving HIV treatment, a milestone of sustained systems and community engagement. To make such progress universal, we must invest in what underpins it. Electricity for every clinic, digital connectivity linking rural nurses to specialists, and fair pay for the workers who keep systems alive. Health spending is not charity, it is nation building. Every dollar invested returns many times in productivity and peace. The second pillar, resilience, is the bridge between crisis and continuity. The WHO African region responds to more than 100 public health emergencies every year, from Ebola to cholera to floods and droughts. But each crisis has strengthened our capacity, new laboratories, trained responders, and a continent that understands the value of cooperation. We are integrating climate adaptation into every plan, supporting solar-powered vaccine fridges for off-grid areas, fortifying health facilities against future floods and storms, and building early warning systems that protect both people and crops. Together with Africa's CDC, we are strengthening national public health institutes as a continental network of surveillance and rapid response, an early warning system rooted in solidarity. Resilience must also heal minds. Aisha's story reminds us that mental health and psychosocial support are vital to recovery. Preparedness is not only measured in stockpiles, but in the confidence of our people to stand and serve when threats strike. The third pillar, modernization, is how we transform resilience into sustainability. Africa is already a laboratory of ideas, mobile money health payments, drone deliveries, and AI-assisted diagnostics. Our scientists lead in genomic surveillance. Our researchers and programs have driven the trials and rollout of malaria vaccines, now expanding across the continent. The task ahead is to scale what works and share what we learn. Our work at WHO in the Africa region includes building regional technical hubs, digitizing processes, and bringing expertise closer to countries aligned with Agenda 2063 and the AU Health Strategy. Modernization also means investing in people. Community health workers are our quiet revolutionaries. With training, digital tools, and fair pay, they extend care to the last mile and rebuild trust in health systems. Transparency and accountability complete this pillar because credibility is the currency of public trust. The fourth pillar is ownership, our pathway from dependency to sovereignty. Around 80% of the WHO Africa region budget still comes from voluntary, often earmarked contributions. That must change if Africa is to set its own priorities. Governments must increase domestic investment and treat health as national security. Innovative instruments, debt for health swaps, climate health bonds, blended funds can help bridge the gap. We must also produce what we consume. The COVID-19 pandemic exposed our reliance on imports. But new vaccine and pharmaceutical plants in Dakar, Cairo, Nairobi, and Cape Town prove that self-reliance is possible. Every vial produced in Africa is a declaration of sovereignty. Health sovereignty is not isolationism. It is partnership on equal terms, Africa contributing data, science, and solutions to the world. This summit theme reminds us that our sovereignty will be secured in the solidarity of one Africa, one health. Innovation is the bridge between our vision and our reality. When families monitor blood pressure at home, when youth share verified information online, and when women demand safe childbirth and clean water, public health is already happening. Governments must create environments that foster literacy, trust, and access so that empowered citizens become the first line of defense. The private sector and civil society are vital allies. Manufacturers localizing production, tech startups digitizing supply chains, and community organizations ensuring no one is left behind. Co-creation with these partners is the engine of sustainability. When we say empowering communities, we mean placing trust and resources where impact is greatest in the hands of our people. Africa's role in global health must reflect its population, its burden, and its brilliance. We are no longer content to be the case study. We will be the reference point. The WHO African region's eradication of indigenous wild poliovirus proved what solidarity can achieve. We contribute solutions to the world, from equitable vaccine delivery to climate health adaptation and digital innovation. Our voice in global forums must be united, evidence-driven, and confident. That is how representation becomes influence. Excellencies, colleagues, friends, let us see this summit conclude with actionable commitments. Let us affirm our promise to embed self-care and community empowerment into national strategies, strengthen research and innovation to inform policy, mobilize domestic financing for universal health coverage and health security and sovereignty, foster partnerships linking governments to private sector and civil society partners, and report annually on progress towards our common goals. Actionable commitments will turn today's dialogue into the deliverables of the decade. On behalf of the entire WHO Regional Office for Africa, I reaffirm our commitment to this shared vision of sovereignty, sustainable health systems designed, led, and owned by Africa. If we can transform a hospital, we can transform a continent. If we can save one life, we can inspire millions. Let us build systems that endure, communities that thrive, and solutions that last long into the future. Together, let us make the promise of health for all the defining achievement of our time, inspired by the courage and commitment of the health workers and community champions we celebrate here today. Thank you very much for your attention.
Ladies and gentlemen, may we appreciate our keynote speaker this morning. Thank you very much, Dr. Abdurrahman Diallo, for setting the stage at this very first Africa Health Summit. Shortly, we'll have our very first panel discussion, and that will focus on the work being done by our scientists. But before that, one of our key stakeholders and a strategic partner for the Ministry of Health and all the other players in this sector is our Gavi CEO. And may I invite you to take a look at the screen. We have an opening statement. She couldn't be here with us, but would like to run her opening statement. So ladies and gentlemen, on the screen, the Gavi CEO, Sania Nishta.
Honorable Ministers of Health, distinguished delegates, partners and friends, I'm honored to share this message of solidarity with the Africa Health Summit. I want to congratulate the government of Uganda, and I want to commend my sister and Her Excellency Minister Jane Ruth Acheng for her vision and leadership. This summit comes at a crucial time for the African continent and the world. Across Africa, we see a complex picture, rapid progress tempered by persistent and profound challenges. As you know, health systems are under strain from economic shocks, climate pressures, and a growing burden of disease. At Gavi, we believe that strong, sustainably financed health systems are the foundation of every success story in global health. Immunization can be the backbone of these resilient systems. That is why, as we move towards Gavi 6.0, our focus is on country ownership and long-term sustainability. Through our transformation, we have transformed the Secretariat to put countries first. and to do everything within our mandate. That is why we are strengthening our collaboration with governments to mobilize domestic resources. That is why we are broadening and deepening our partnerships to attract innovative financing and ensure that every dollar invested in health delivers lasting impact. And that is why we have launched the African Vaccine Manufacturing Accelerator, or AVMA as we call it, to support a sustainable African vaccine manufacturing ecosystem that will provide jobs and growth at the same time as strengthening regional and global health security. The Africa Health Summit is a call for sovereignty. It's a call for solidarity and innovation, and Gavi is answering that call. So to every participant in Kampala today, I urge you to keep pushing the boundaries of what is possible. Your leadership will determine not only Africa's health trajectory, but the world's collective health security. All of us at Gavi stand with you. Thank you, and my warmest wishes for a successful and inspiring Africa Health Summit.
Ladies and gentlemen, our very first panel discussion. And I need to prepare you, because if you didn't do any science classes, you may have to Google some of the words they will be speaking. And this is when you wish you had stayed in your physics and chemistry class a bit longer. But more importantly, why did you drop biology? But why? So ladies and gentlemen, allow me to invite our scientists who will be looking at operationalizing the new health order, the new public health order. They'll also be looking at scaling Africa's health manufacturing agenda and catalyzing innovation for health sovereignty. Invite Uganda's very own Dr. Misaki to come. Dr. Misaki will introduce his panel. And please, scientists, we have an audience that never went to medical school. Please help us understand the heavy words that you will be sharing. And if you can, try and lay them out for the layman, like some of us who did social sciences, all right? So ladies and gentlemen, please welcome Dr. Misaki.
Thank you, Maurice. Thank you, Maurice. Good morning. My panelists kindly come up. Dr. Mazaba Lucy, the Regional Director for Africa CDC. Dr. Mosoka Fala, Dr. Babe will join us from online. I don't know whether Dr. Babe is on. The Africa CDC is Africa's autonomous continental public health body that was inaugurated in 2017, but the plans, I think, had been in place since 2016. And it's amazing that this coincided with the biggest outbreak of Ebola in West Africa. I welcome you today because we expect to hear from you to tell us how Africa CDC is operationalizing the new public health order. In 2023, following the challenges that we all experienced during the COVID-19 pandemic, Africa CDC passed this package, the new public health order. Lucy, could you briefly tell us what this is about and how Africa CDC is working to operationalize this?
Thank you. Thank you. Thank you very much. So when you're being introduced, I heard Misika, and I'm like, our very own. So now Japanese have become Ugandan. So I did a bit of training in virology and immunology in Japan, and that name sounds very Japanese.
Yes.
But interesting to be here with you, and thank you very much for the opportunity to allow the Africa CDC to have or be part of this conversation. I think you've rightfully said that we've had a lot of lessons learned on the African continent. And indeed, one of the reasons the Africa CDC's birth was escalated was because of the Ebola 2014 outbreak that hit West Africa. And I think the heads of states and government, guided by their ministers of health and other technical persons, recognized that there was need to have a sovereign body on the continent that would help secure the continent's health. And so the Africa CDC, after discussions and endorsement by heads of states and government, was actually established in 2017. And after that, just at birth, a few years later, shortly, COVID-19 hit. And we had some systems in place, still quite young, but also leveraging on the strengths of the member states, were able to manage the COVID-19 in a decent manner, securing, though late, a number of vaccines, improving diagnostic capacity in the member states, and so on and so forth. So looking at all these situations that have occurred and stressed the health of our people on the continent, we needed to relook at how we manage health security. And so the new public health order was born. And really, to just get to the point of what you are saying, one of the important things that was noted is that Africa has to become responsible for the health of its people. And how do we do that? We need an important capacitated workforce. We need financing. We need medical supplies and products. We need institutions that can manage this. And so you did hear from Dr. Diallo talk about how we're pushing the establishment of NPHIs or public health institutions on the continent, and that's one of the major pillars of the new public health order. But we're also looking at the conversation around local manufacturing, innovation, which Dr. Mosoka will also talk into, and ensuring that we have enough commodities on the continent. We're looking at financing, and I think the previous speakers in the keynote expressed, and the speaker also expressed, about domestic financing being a real game changer. So when you look at all these matters, this is what we're calling the new public health order, things that we've had conversations over a long time but need to be actioned. Thank you.
Okay, thank you, Dr. Lucy. I'll return to you, but let's go to Dr. Mosoka. Without undertaking R&D, Dr. Mosoka, whatever we are envisioning in terms of local manufacturing will simply be fill and finish. We will not have ownership of the IP. Could you tell us what you're doing, what you've been doing over the years to position the African continent, as well as, of course, set traction for African scientists to develop their own R&D agenda? How do you plan to finance this?
Thank you very much. I want to take a step behind. Financing is not the issue. Innovation and sovereignty is the theme. There can be no sovereignty when there is not economic power. And what drives economic power is innovation. I like to use this illustration whenever I speak to people to compare Africa, India, and China. Africa as a continent has 1.4 billion people. China has 1.4 billion people. India has 1.4 billion people. India is the second largest producer of pharmaceuticals, APIs. China is the second, India is the third. In 2023 alone, India reaped $50 billion from pharmaceutical industry. If you take the amount that India got from pharmaceutical industry, 50 billion, is equivalent to the GDP of over 10 African countries just from pharmaceutical. That is followed by China is number 2. Most of the formulation and API used in Latin America and the US comes from China. 1.4 billion, 1.4 billion. Let's look at Africa. 1.4 billion people with the same brains, but they are importing 99% of their vaccines. They are importing 95% of their drugs and diagnostics. So what is wrong with this picture? This is what we are trying to address, that the fundamental issues of R&D must be addressed if Africa will get to the point where we can produce innovations that will drive manufacturing. But there are 4 critical issues Africa must overcome. And these are the actions that we in the Science Directorate are trying to overcome. 1, Africans don't know what exists on the continent. Africans don't know what sort of infrastructure exists on the continent. There have been millions of dollars of investment from PEPFAR to do research, but an African scientist in Uganda may never know what exists in South Africa. So how are we addressing this as Africa CDC? This year we launched an ambitious project to map all of the research infrastructure in the 55 member states. As I speak to you, we've done 25 countries, and by December we'll be doing 40 countries. Next year we'll do the 15. Our findings has been very impressive. We have over 500 research institutions across different spectrum. What does that mean to what's going in R&D term? We are going to launch 2 studies very soon. One is an injectable malaria vaccine. The second is a molecule developed by African scientists from University of Cape Town. We are going to launch 2 phase 1 trials in Africa by African. What did we do? We went to our database and queried our database and said, how many phase 1 trial sites exist on the continent? We found 34. Now what we are doing now is deep diving and say which one of the 34 sites is able to run a malaria trial. So for a long time, Africans didn't know what was happening. Number 2, African scientists operate in silos. They do not come together to work together. And so I went to school in the US and we ran major projects. You have 4 or 5 universities working on a major issue, but at different spectrum. Africans don't know what is happening on the continent. Now what we've tried to do is to bring scientists together on a major thematic areas. What have we achieved? Last week we had science South Africa, Tanzania, and Kenya. Our colleagues in Tanzania and South Africa can do the nanotechnology. All of these exist on the continent, but people did not know. So Africa CDC role has been bring scientists together across the continent. The third weakness we have is that we have not had research architecture framework to do that. When I took over the Science Directorate, our first business was to develop all of the framework to govern research on the continent, including research prioritization.
We can manage financing on the continent. Dr. Abasoka said there's a lot of resources, and this is just not natural resources. There's even money, there's financial resources on the continent, but it's how we distribute it. So in countries where they've recognized that health is a key driver of the economy, of development, they are putting more money on that aspect, and we need to get our member states to get there.
Thank you, Dr. Masoka. You just launched the R&D framework. Could you please tell us a little bit about it?
So 12 years ago, I was a young graduate running after Ebola in West Africa, and there were a lot of parachuting of scientists. Scientists would come parachute into our country, take our samples and leave the country. There was a time a group took the sample at 4 a.m. There was no coordination, and so Africa did not gain. So essentially what we've done with the R&D framework, for the first time under MPOX, we've got a clear guidance how to coordinate research. If you cannot coordinate, you cannot track. If you cannot track, you cannot see your benefit. We've launched that, and that's going to be the modus operandi for almost all of our research. On the 27th and 28th, we are bringing together 40 scientists to look at arboviruses, the Rift Valley fever, the dengue fever, and chikungunya, and see from an African scientific perspective, from infectious disease modeling all the way to medical countermeasure, what solution exists. So essentially, the R&D framework is to coordinate, track, so that we do not lose resources.
Tell us about the composition. How is it framed?
Okay, the way we frame it, after our meeting last year in Addis Ababa, we had one thought. How do we group the African scientists by their expertise? So we took big diseases, the filoviruses, the Ebola and the Marburg. We created one group and brought all of the scientists together. We took the arboviruses, the dengue and the Rift Valley fever.
So how is this all going to be governed?
So they are already being governed. We have monthly meeting. We created a framework where the team in my department meet with the filovirus group, the medical countermeasure group. They're meeting once a month. Even have the modeling group and the social behavior science group comprising of 10 member states. These people are going to meet in Addis and say, from the perspective of medical countermeasure, what do we have for Rift Valley fever? What kind of vaccine candidate we have? Like I said to you, we are closely working with our colleagues in South Africa that have had 2 molecules, one against chikungunya, one against Marburg. We are also trying to do nano-modification of ribavirin to be able to treat Rift Valley fever. We're going to come together by African and saying, what is our solution? That will be the composition of scientists across the discipline.
So tell us about the ministerial arrangements, the continental arrangements for overseeing R&D on the continent. That should probably be the last.
So basically, the way we solve R&D, that if we do not have the highest political level of support, we'll never be able to move R&D forward. So we created a framework by bringing together 132 scientists, ethicists together in Addis Ababa, and say, how do we want to govern research on the continent? At the highest level, we have a president to be the ambassador. The president will be the ambassador for R&D. What we foresee is that as a president, he can speak to his colleague for budget allocation. But we need stronger political will. Below the president are the ministerial advisor on R&D. This will comprise of Minister of Health, Minister of Science. These will be the ones that will be our major driver to advocate for result of R&D to lead to innovation and manufacturing. Below that, we have some of our senior scientists to lead the technical aspect of R&D. We say when we coordinate, we can track. When we track, we can optimize the benefit of R&D.
Thank you so much. Ladies and gentlemen, we would go on and on. I think this session was aimed to make sure that you appreciate that Africa CDC is offering us leadership. We are in the right hands. We should just position ourselves to follow the guidance that they have in place for us. Thank you, Lucy. Thank you, Dr. Fala.
Ladies and gentlemen, can we appreciate the panel? Big round of applause. All right. And so it's a really cool idea to ensure that anyone coming to speak will be right in the middle of the summit. And that explains that this is why we really are here. The crux of the matters to be discussed around innovation, the new health agenda, and how the private sector and, of course, all the key stakeholders can support all the initiatives that players in the health sector are rolling out. So allow me change the program quite a bit. We will make a bit of adjustments as we move. But allow me mention that shortly we will have another panel discussion, and this will be a ministerial panel discussion. And as soon as we are set for that, we will let you know. But before that, we want one of the private sector players to make a statement and a presentation on what regulatory and quality assurance reforms are needed to support Africa's pharmaceutical product sovereignty. And so I'll invite to the stage Mr. Emmanuel Katongole, who is chairman and co-founder of Quality Chemicals Industry Limited here in Uganda. Ladies and gentlemen, please welcome Mr. Emmanuel Katongole. As he makes his way, I am just hoping someone is managing my boss. I'll introduce two things. At an opportune time, an usher will come and invite you to coffee. The idea is to try and make sure we have a working coffee. We don't want to lose the conversation. And so you will notice that, if you can, and you can pick a takeaway cup and come back when they usher you to the serving center, please do. The idea is the more you stay away, the more content you will miss, and the more of the conversation you will miss. But we also appreciate that most of our audience and most of our stakeholders are online and they're joining us online, and we really want to appreciate that. And so we will continue to broadcast and share the conversations throughout. We will not break. The only break we have is later, after we close the summit for lunch, and then we introduce the Heroes in Health Awards. So as I invite Emmanuel Katongole to take to the stage to make his presentation, I just want to let you know that there will be a time when the ushers come and usher you to the serving center to pick some coffee. And so we will definitely let you know, and the ushers will do that. So they will do that for you. So it's a working break, but we'll keep the activities going. Shortly, Emmanuel Katongole will come and make his presentation. And as soon as that is concluded, we will also have a presentation from our very own Ministry of Finance, Planning and Economic Development, and later the Ministerial Roundtable. All right, I'm just checking that we have the next presentation. So I'll let Andrew know. Andrew, can we handle the presentation by Robina? Are we able to do that? That mic, so it's up to you, sir. So can we warmly welcome Emmanuel Katongole, ladies and gentlemen? And just as he prepares this, I just need to mention that if you haven't done your research on quality chemical, please do, because there's a lot of work that is being done in Luzira, and you need to see the innovations that they are driving. Do you prefer this mic? I can give you this one. Or do you want the other one, Chair?
The honorables here, I can see our permanent secretary, to you leaders in the scientific world, and captains of business and industry, a very good morning. I was asked to talk to you, share our views about regulatory and quality assurance reforms that are needed to support Africa's pharmaceutical products sovereignty. But before I do that, I had a presentation, but I think we can do away with it. I wanted to share with you our story, a story of quality chemical industries. About 25 years ago, our country, Uganda, was at crossroads. HIV/AIDS had reached a very unacceptable incidence rate of about 15%. Just imagine every 100 Ugandans you met, 15 of them were condemned to death. Such a terrible situation for a country. And it went unchecked, an entire population was even worse. Our country, Uganda, was losing 400 people plus every day because of malaria. Just imagine, for those of you who travel to this country, you are in a jumbo jet that carries 400 people, and every day it crashes and all people on board die. Absolutely unacceptable. It was a very terrible situation in our country. One great man said that could not be sustained and had to be stopped. And that great man is His Excellency, the President of the Republic of Uganda, President Museveni. President Museveni was very intentional and said we must do whatever it takes to stop this carnage of human lives. He started with prevention. When it came to HIV/AIDS, he was the inventor of a popular program called ABC. Abstinence, being faithful to your partner, or if you cannot do the two, use a condom. This became a very popular model in preventing HIV/AIDS, and if one was to get a Nobel Prize, President Museveni deserved one for that. I'll tell you what the result was. Because we introduced this ABC to media, to schools, everywhere you went in Uganda, ABC became the thing to say. What were the results? The incidence rate for HIV/AIDS slowly came down until it stabilized at around 6%. That is probably the biggest achievement for any HIV/AIDS program anywhere in the world. Anywhere in the world. And when it came to malaria, again, President Museveni with his team, the minister, the permanent secretary, came up and said, let us use systems that will prevent malaria. He advocated for insecticide mosquito nets. He advocated for indoor residue spraying. The numbers of people dying of malaria started coming down slowly. But then, there were people who were already sick. When it came to HIV/AIDS, we had over 1 million people suffering from HIV/AIDS. And yet, the country was able to treat about 100,000. The 900,000 just died off. When it came to malaria, still, despite the achievements, malaria was still killing people. And President Museveni called upon the private sector to come and intervene. And our business, Quality Chemical Industries, was the first in this country and one of the very few in Africa that headed to this call. We set up our manufacturing facility in 2015, in 2005. And under partnership with Cipla Limited of India. And in 2007, as part of our independence celebration, Quality Chemical Industries became the first private company in sub-Saharan Africa to get World Health Organization pre-qualification for HIV/AIDS and malaria medicines. That opened the road for Africa. The story is big. What has been the result? That today, as we speak, Uganda treats whoever has got HIV/AIDS and does not mind about stigma will have medicines free of charge manufactured by quality chemical industries in Uganda. And thank you, Minister Jane Acheng. Thank you, Permanent Secretary Dr. Diana Twini, for supporting the vision of His Excellency the President. Because this has been achieved, and I know many friends and many people who actually look like me, and they have got HIV/AIDS, and they take their children to school, they are able to have children who are HIV negative, and life is normal. And if one got it at age 40 and died at age 80, at least that's close to normal life. Thanks to His Excellency President Yoweri Museveni. Malaria, today, and thanks to the efforts of government, in Uganda, we're losing over 400 people every day. Today, we lose less than 15 people. That is a huge, huge, huge leap. I am a businessman. I'm not a politician. But when we hear of protecting our gains, fellow Ugandans, let's protect the gains. Those are very serious numbers. Let's protect the gains. Now, I go to regulatory, and by the way, when I speak about Uganda, in a way I speak about Africa. Because quality chemical industries has a footprint in 34 African countries. 34 African countries where we registered, and many of them we do active trading, and we are extending our footprint to neighboring countries. And my sister here, Her Excellency, the Ambassador of Ethiopia, will tell you the story. It is what we must do as a continent. But there's some crisis that we see on the continent, and we see it every day when it comes to regulatory and quality assurance issues. 10 to 30% of drugs in circulation in Africa are either substandard or falsified. This is a WHO estimate. 10 to 30% are actually fake medicines. What does this lead to? An average of 100,000 die because of preventable death annually that is caused by these fake medicines. That is a big challenge. Challenge number 2 on regulatory framework. We've got 54 countries, but you cannot believe that we have got 54 systems. As I told you, we have presence in 34 countries. Can you imagine that in every country, we go to register a product, they ask the same data, the same way, and you've got to repeat what exactly you did. I sat on a panel of WHO that was to harmonize registration processes. And it was agreed that we should have at least harmonization at regional level. At ECOWAS, East African Community, SADC. But despite this resolution, it does not happen. When I register a product in Kenya, in Uganda, I've got to register it again in Kenya, which is absurd that we should be doing this. It's only a few countries in Southern Africa called Zanzibar where you register in one country and the other countries listen to you. Honorable ministers, this is something that you should take up because it's a big challenge. During COVID time, Africa waited for months for vaccines while others stockpiled. Africa imported 70% of the vaccines. I remember Honorable Musenero here really struggling to make sure that vaccines were available. South Africa is the biggest HIV, ARV treatment program in the world. They were caught off guard, completely off guard. We had to hire passenger planes from Kenya Airways to take medicines to South Africa for 6 months to make them survive. Otherwise, they were going to perish. This kind of stuff should never be tolerated. What are the reforms that are needed to streamline and to empower systems? Number one, we must operationalize the Africa Medicines Agency. This was started in Kigali, Rwanda. Our leaders accepted on that. But then, up to today, we don't see it being operationalized. We need to make it operational like yesterday. We must have regulatory oversight, harmonized guidelines, inspection, and pharmacovigilance. Friends, if the National Drug Authority could be limited to supervision and pharmacovigilance and get the registration processes, at least for East Africa, all merged into one registration process, we would save 2 to 3 years and 50% of the cost of manufacturing medicine. We need to do that like yesterday. We need to advance regional harmonization. As I said, East African Community, SADC, ECOWAS, this is very critical. We must build regulatory capacity and independence. Strengthen our systems, particularly when it comes to checking on fake medicines. This can be done under a harmonized system. What are the quality reforms that we advocate for? One, we call for a Pan-African GMP standard. One single African GMP standard. We call for that. And it's an easy ask. I know that most of the regulators in Africa depend on these charges to survive. But we should not really be mortgaged by simple incomes and we'll miss out on the bigger stuff. We should not. Let national governments plan on how to fund the regulators, but be able to produce and be able to expand our reach when it comes to medicine manufacturing. We need to increase capacity for testing. New companies are coming up, like Mayhem, producing test kits. But it is a small drop in the ocean. Let us increase our capacity to do that. We need to streamline our supply chain and tracking of quality checks at import. You should not allow medicines to come into the country and then start tracking it. It should be arrested at the point of entry. And this we ask, a simple ask that can save our African countries. We need to strengthen post-market surveillance to catch issues early. And those are the issues that national regulators can do easily and leave regulation to be harmonized in 2 regions. Friends, we have diagnosed the disease. And this disease is dependence. We cannot afford to solve African problems using imported solutions. We must use our African solutions to solve African problems. And the Honorable Guest of Honor, the Honorable Deputy Speaker, Honorable Minister talked about this morning. Let's put it to action. Let's put it to action. Let's support, and let's be very deliberate, like President Museveni was very deliberate to supporting us at Quality Chemical Industries. Very deliberate, very intentional. And once we do that, for example, malaria, 80% plus of the disease is actually manufactured in Africa. And what we import, rather what we manufacture is less than 5%. Manufactured by only 2 companies in Africa, including my business. We must change this. We must change this. It is a responsibility, it's a human right, and once we do it, we shall have true independence of health.
Chairman, I don't like to cut you short, but we have a few more minutes. 1 minute to go.
Please. And we have prescribed the cure. Targeted regulatory and quality reforms. It is high time that we implemented this. Honorable Ministers, thank you for the support. Please, when you see President Museveni, let him know that we appreciate his support and we shall defend the gains thus far. Thank you.
Ladies and gentlemen, please appreciate Mr. Emmanuel Katongole, Chairman of Quality Chemical Industries Limited. Thank you, Chairman. I'll come and help with that, don't you worry. Can we appreciate the Chairman one more time, ladies and gentlemen? And since he set the stage and made suggestions on what we need to do to build our sovereignty, allow me quickly transition to the state of health manufacturing in Africa, reclaiming sovereignty, financing, innovation, and of course, building a resilient health economy. I want to invite the Minister of Science, Innovation and Technology to quickly come and take us through her presentation. And usually the problem, Honorable Dr. Jen Ruther Cheng, is managing the time of Dr. Musenero. It is the biggest problem. But I am going to try, because she can even give you 99 slides. For her, she's doing a lot of work in the ministry. So, Doctor, we have 10 minutes, and I'm going to count you down. I'm glad Chairman Katongole gave me 30 seconds back. So you have 10 minutes and 30 seconds.
I would like to sit.
Yes.
And have more of a conversation. Honorable Minister of Health, I request that you allow me to stand on the protocol already established. Thank you for inviting me to be part of this conversation. And especially, I'm excited about the theme, Reclaiming Africa's Health Future from Dependence to Sovereignty through Innovation and Solidarity. I took the liberty to think through this theme and thought that what we want to do is to redeem our health future from where it had got logged and it sort of gotten lost. And we find ourselves in a very unsustainable pathological dependence. And we want to innovatively redirect this path so that we can gain sovereignty and build a sustainable future of the health security of our people. When I thought through this, I related it to many other sectors that we have been analyzing and studying. And we discovered that all sectors develop based on two fundamental things: philosophy and ideology. The philosophy guides us as individuals and as societies on how the general way we are going to approach. And that philosophical understanding of our sector helps us to filter through the approaches. And the ideology lays down the guidelines, the hard guidelines that will take us forward. And so as we begin this discussion, I thought we needed to understand what drove us to where we are. We make a proper diagnosis so that we are institutionalizing solutions guided by the right philosophy for the health sector and the right ideology. Because once we define those, it will help us to collaborate across sectors, collaborate across nations. Now, we find ourselves with the African health sector, and an analysis shows that while for us in the continent, we have typically developed the health sector on a social service philosophy. The Western world, which has built a different way of health and serves as a donor community to us, their philosophy was science-driven, industry-centered health economy. Instead,
tandika izuba emirimo urugendo ninga kahumuro neco kunywa cha chituzi yenywere chituzi ohurira amatwenge aha mu miro nikikorwa ku rugo mu chituzi cha shitake amajani hamwe n'obwoki konjora bunuzi hamwe no mutindo eki nikikorwa ba chituzi farm company limited abeine teknolojia nebyoma byo mutindo. Chituzi drink ekirizibwa kitongore cyo mutindo mu ihanga echa UNBS kandi nashangwa mu maduka na supermarket zono mu ihanga kushubura tera simu noti mushanju munana mushanju bisha twina bitana shatu nemwe ninga noti mushanju munana mushanju bisha twitano 00 mwenda.
Every journey begins with a strong foundation, from bridges that connect us to power that drives our future, from towers that shape our skyline to railways that carry our stories, from welcoming gateways at Entebbe to the roads that open our protected lands, to the landmarks that define who we are. One name that holds it all together. Built strong, built to last. Built with Hima Cement.
abari kushangwa protein abikumi na mushanju garage street abatwire ni batwisiye ubuhereza bwo kubika no kwewura amagoba make batugabura mu bishoguzo byabo byo kubarebya kikumba kwereza abanya
wasinja DJ wasinja kutsebu bore mundu wosi uyowe uwityo bwiranda orekerera ndeke kusangwa prime minister akayatubura busano buri kitwa byanu munire tata prime minister akatambikano urekinga kuherera yeko masinja kutseba. Okay, wasinja umushakolomo kolosa bureka mushakolo chidoha Yusufu ware kololo mebolo ekiro kya munabwire mureke ndasake hayo murenge hakabi hanya abandu bakanziri oburenga buhwehwe ekiro kya munabwire tukanzara kerandreke omomye kitano eno 1225 26 1229 makumi asatu